Welcome to Cancer Explained with Central Care Cancer Center. It's likely that someone you know has been diagnosed with a form of cancer. Learn more about specific cancers, their risks, signs, symptoms, and treatment options by listening to Cancer Explained.
Hello and welcome to Cancer Explained with Central Care Cancer Center. My name is Leanne Powers. I'm the Marketing Director for Central Care Cancer Center, and with me today is Radiation Oncologist Dr. Perez-Tamayo. At any time, feel free to email with any questions or comments to askdoctor@cccancer.com. That's ask, DOCTOR, @cccancer.com. November is National Lung Cancer Awareness Month, so today our discussion on Cancer Explained centers around lung cancer. Hello, Dr. Perez-Tamayo.
Hello, thank you for having me today.
Real quick, would you mind telling me maybe a little bit about how Central Care Cancer Center really began or got started here?
Well, I never dreamed of living and practicing in Kansas. I am really mostly from Chicago. My family is from Chicago, parents, doctors in Chicago, and my siblings, 6 of us in Chicago, most of us are doctors. But I came here with the intention of not staying, and I did stay now for 30 years. And the reason why I didn't intend on staying is I really didn't have family members here or anything really to pull me. But what really got to me was how nice the state was. And at the time where I started was in Salina. It had won an award for a friendly and safe place to live, and I had just had a child. So I was just in love with the whole sensation of safety and wonderful people. And I also found that there was a huge opportunity to improve and increase cancer awareness and treatments. I was first to publish in the world on IMRT, which is intensity modulated radiation, which is a way of bending the beam to focus on your cancer alone and exclude critical structures. And I was there at a tenured track at the University of Michigan, and I brought things with me. They were willing in Salina to actually support these studies and become what we call a beta siter, the first in the country to bring this technology to a community center. And from there, we've actually grown by bringing this special technology to all aspects of Kansas and now Missouri as well. So this makes it easy for people to have the best access to cancer care near their home, because I do feel that having a less burden, less anxiety about your treatment because you're not in your hometown and with your family, or that you may not be able to reach your work or your family could bring extra burden to your body you don't need. And it's very important to understand that, for instance, in chemotherapy doses, and the chemotherapy is the same everywhere in the world, is really by the weight and your height is called meters squared. So the same drug, whether you're here or in Algoma, Wisconsin, is the same because it's purely by your weight and your height. So if you need a certain type of medication, a chemotherapy or immunotherapy for the type of cancer, it is the same wherever you are, you will receive the same drug with the same amount. So why have to travel if you can get the same treatment near home?
Okay, so we are supposed to be talking about lung cancer, so let's get into maybe some symptoms and signs. Something I know that you've mentioned before regarding lung cancer is that when you have symptoms, it's already too late.
Yes, I was fortunate enough to be trained by Dr. Jim Cox and Dr. Ritsuka Komaki, who actually retired and now has perished from the MD Anderson Cancer Hospital in Houston. And he was Mr. Lung Cancer of the world at the time of my residency. And so we saw more cancers of the lung than I would venture to say most people, because he had such a reputation on lung cancer. In fact, I was fortunate enough to be able to publish papers with both of them on lung cancer, and it's really one of my passions. Why? Because, we have such an opportunity to cure cancer of the lung when it's very early, and such a terrible, dismal type of response when it's already spread into other organs. It is a silent killer. By the time you have symptoms, it is usually in a stage 3 category. And therefore, now that we're able to have the ability to pick it up before it spreads and becomes almost incurable, why not do that when your chances of cure are in the 90th percentile?
So who would typically be at risk? I think when I think of lung cancer, I think of mostly maybe men, but women are just as high of a risk, right?
Well, unfortunately, we have risen to that level. We were not, because at times in the past, women were not really as bad of smokers as men, and the exposure to other carcinogens were not as common in women. But now that women in many ways are equal in many ways, we are also equal, unfortunately, in the getting cancer of the lung. But it is still more common in men, and it is equally as a killer. Now, we have some people that are higher risk, and those are, of course, the people that smoke or that burn trash or burn any kind of anything, really. It could be
Like
wood,
campfire
campfires. Anybody that is around smoke is going to be at risk. Secondhand smoking plays a big role, especially when you're exposed. If you're a child and you're exposed to a secondhand smoking situation or a wood-burning stove, for instance, you are at higher risk than if you're exposed later in life. So being exposed at a certain time of your life is very important. And also, if you have cancer of the lung in the family, you can actually be a non-smoker and still have lung cancer because you have a propensity for certain types of cancers of the lung because of a family genetic mutation.
What about even like air pollution or asbestos or something like that? Is that, again, those additional kind of
carcinogens? Yes. You know, we did a study where there's these big nets that pick up pollen, and we actually report the pollen count. You can see it in the news sometimes. But actually what you see more than pollen in the bigger cities is tires, pieces of car tires. So what you're actually breathing is pollution, but a lot of tires are going into your lung, which are usually a petroleum-based product, and they are very high carcinogens, and at a minimum, they're very toxic to your lungs. Even if they're not going to cause cancer, they're going to cause very significant COPD or asthma that will be there forever, and scarring. Now, there's also asbestos. I have many histories of women, for instance, who were non-smokers that were in their kitchen most of the day, but unfortunately, the pipe that would bring up the heating or air conditioning to the kitchen was lined by asbestos, and they became a victim of cancer of the lung or of the lining of the lung, the mesothelial cells or mesothelioma. It used to be that we had clothing that was lined by asbestos because they were fire retardants, and even the roads had asbestos in it, again, to retard fire. In fact, many of our longtime motorcycle enthusiasts, including some of the movie stars, died of lung cancer, not because they were smokers, but actually they were exposed to open roads where there was asbestos.
Never knew. What about even like radon or that colorless, odorless gas?
Yes, and in cancer, this is a very important question. We live in in the Midwest, is particularly prominent to have radon, which is a gas. It's a decay of a radioactive substance that is very, very highly toxic and carcinogen. And this comes from deep in the ground, and you should always make sure that you are free of that in your basement in particular. And there are kits that will tell you whether you have something to worry about. And sometimes even landscaping it can reduce or take away completely the radon. So it is not worth your health and the health of your loved ones to be exposed to radon.
Again, I'm with radiation oncologist and president of Central Care Cancer Center, Dr. Perez-Tamayo. We've been talking about lung cancer as November is National Lung Cancer Awareness Month. I wanted to ask you, doctor, about the types of lung cancer. You hear commonly like non-small cell and there's small cell, but is there anything more we should know about these types of cancers?
Well, yes, and especially for people that are very much into the type of cancers and how to treat them, this classification of non-small cell and small cell In fact, to be very frank, in academic circles would be offensive. And that's because it is truly very different depending on what kind of cancer we're looking at, and what is the cell of etiology, or where did this cell, the cell that first brought on the cancer, where did it come from, and why is that important? Well, there's many reasons for it. The behavior of the cancer is very different depending on these broad categories, the non-small cell and the small cell. I'm just going to make it easy because, again, we can get into very hairy and very specific scientific terminology. But in the non-small cell, these cancers are, as they say, the cells don't look small. In fact, the small cell is sometimes called oat cell carcinoma because they look like little oats. But the non-small cell carcinomas are a big category. There's everything from an adenocarcinoma to a squamous carcinoma to a large cell carcinoma and others. And what it signifies different things. And actually, it's a shame that we are dividing them in this way because they act so differently that we really need to be more specific. If you have a squamous cell carcinoma, squamous means flat. In other words, the cells are flat. Usually that's a cancer that is of irritation. It is caused by something irritating it to the point of cancer. And I'm sure that people in Kansas know about this because they've seen animals, either their pets or even cattle. They start gnawing at something that bothers them and it becomes inflamed and problematic. And this is what causes a cancer in the lung. When you have something that hits you just right there, because maybe the way you inhale a cigarette or you're inhaling the carcinogen and it hits a spot that becomes so disorganized or dysplastic, that's what it means. Its growth is not typical, and then these cells start becoming cancerous. Now, initially it can be what we call in situ, or they're still not invasive. They're definitely cancerous or pre-malignant, but then they become cancerous. These cells usually of the squamous cell are actually more of the bronchial tree, if you can imagine your windpipe dividing into the right and left side of your lung to aerate or to give air to the right and the left side. These can get irritated to the point of cancer. Now, the adenocarcinomas and the large cell carcinomas are more about the glands. Adeno is the glands, or what causes the mucus in your lungs. The mucus has many properties, and one of them is so that the air or the oxygen can diffuse into the bloodstream, but also lubricates and makes and cleans your bronchial tree from pollutants or particles. And these adenocarcinomas can also be genetically fragile. In other words, if you bother them enough, they're going to become malignant. And it can be multicentric, meaning that these cancers can start in different parts of your lung at the same time. Now, these can be very slow growing, and actually just you remove them one at a time. You treat them just as if you were taking away a knot from, let's say, your arm, and then another one may form higher up, and they're not related. They're not necessarily metastatic or spread. They're just starting out de novo or anew in different parts of the lung. Now, there are others, adenocarcinomas, with different properties and different receptors that may be very malignant. And they can be multicentric, but they're actually metastatic. It's very important to understand that multicentric may be that a cancer spreading like you would imagine a plant that has a root with saplings or little, rootlets coming out of it, but it's the same root. That would be metastatic, versus a different and completely different cancer that is starting all on its own. The prognosis of each of these is different. So you have to know, again, what kind of cancer you have, because the prognosis and the treatment varies because of its behavior.
So how does it spread? How does cancer in the lungs spread then?
Well, it can spread through three major ways. One is local, meaning that it starts growing and growing and growing, and then it takes over local structures. It can be your windpipe, it can be your esophagus, it could be your chest wall, depending on where it is. It could also be regional, meaning it can go into the lymph nodes. And we've talked about this before, Leanne. You know, lymph nodes are our filter system. So it goes into a channel called a lymph duct. This duct carries a piece of cancer into a lymph node, which is like imagine a train station, and there it's supposed to decide what is this? Is this a bacteria, or what is this new thing? And since it's something you made yourself and it's part of your own cells, it doesn't know what it is. It sends it to the next chain of lymph nodes, and that's how it spreads through the lymph nodes. And then it can also be picked up by the bloodstream. You can imagine that the lung is like a sponge, and the air, the little sac that actually, the alveola that has the air exchange into the bloodstream, is very rich in blood. In fact, if anybody has dealt with any kind of animal lung, you know it's very highly vascularized, or blood vessels. So this can then go into a piece of one of your blood vessels, and then it comes back to the heart, which is the pump, kind of a pump that pumps the blood into our heads or into our bodies. So that's how it starts getting into our system, by a little piece going into the bloodstream, then being pumped either up into the brain or down into our body or our liver. The first stop of the heart is the liver. So this is why liver involvement is early in the cancer spread if it's blood, or it can also go directly to the brain without passing any other organ and be involving the brain as its only site of spread. And here again, even with people that have cancer in the brain from the lung, they're still curable. But you need to have someone, and I'm going to say like me, that are very interested in cancer of the lung, who are going to be able to give you that extra edge so that we can treat even disease that is beyond the lung, beyond the thorax, in a curative way. You need to have that extra interest to be able to open all the doors and all the windows and all the possibilities of a curative treatment, even when it looks, a little dark.
Well, especially, I was just going to segue into the survival rates and the differences between being diagnosed with stage 1 lung cancer versus stage 3 lung cancer. I mean, it's a big difference, correct?
It is. In fact, stage 1 is almost uniformly curable either by a local surgical procedure or even stereotactic radiosurgery, meaning that we treat you with 1 or 3 treatments and you're good to go. And 90% of the time, you're cured. However, for this to even happen, you have to diagnose it, and it is silent. So you would not know even you have this disease unless you go through screening. And you go through screening because you have these elements of smoking that are, that put you at a higher risk. Most of the family practitioners would have these parameters, and they are about the amount of smoking that you've done in your life. If you're between 55 and 80 years of age and you have a 30-pack year history, meaning let's say you smoked a pack a day for 30 years, or if you smoked more than that, maybe 2 packs a day for 15 years, or you smoked heavily and then you stopped smoking in, let's say, less than 15 years, you can qualify for screening, and it is covered by insurance. Then is when we pick up these early cases, highly curable. Unfortunately, that's not what happens. We have now cancers that become symptomatic because, let's say, they start going into the lymph nodes that are near blood vessels or near the bronchial tree, and then you have the cough that has maybe blood in it, or you have collapsed a piece of lung because it has blocked your airway. And now we're looking at a stage 3 category, which then puts you at a 10% survival.
So basically, if someone listening has this or matches this criteria for screening, they should talk to their primary care physician in order to get the lung screening test, the low-dose CT scan, correct?
Absolutely. And actually, even if you don't have insurance, the low-dose CT is very affordable. So there's no reason why you need to put your life on the line. You can get diagnosed, and the treatment is almost a no-fuss situation. You don't have to even be opened up like before we had to do a huge surgery. You can get treated with what we call stereotactic radiation, 1 to 5 treatments, and you're cured. There's no reason to wait when it's a highly curable disease.
And once again, screening, Dr. Perez-Tamayo, is so important in order, for any cancer, essentially. If you get it early enough, your chances of survival are much greater.
Yes, there are some cancers that are accessible to being detected early because they may be producing symptoms that we can recognize as being abnormal. But lung cancer is not one of them. Lung cancer is one of them that you almost have to persist on getting screened. And, most of the rules as it relates to insurance is that you can only have a low-dose CT scan asked for if you go to your primary care physician. If you go else to another type of situation, even a cancer specialist, then they will not cover it. Why? I don't know. That is certainly the rules of the government are very sometimes mysterious. But the thing is that if you do have a primary care physician and you think you are in this category of a heavier smoker, and many people do not consider a pack a day as a heavy smoking history. It is. Why wait? Get the screening done, get your treatment, and then that's that.
We should also include vaping too, just because there's still so much that's not,
Well, vaping has even more issues because not only is it is absorbed into your lining much more because usually there is warmth, and warmth as you know, if you've ever had a facial or you've ever exposed your skin to any kind of steam, you are more likely to absorb, let's say, a cream or whatever you're putting on your skin. And vaping is the same thing. Not only that, but because of the way that the e-cigarette is made, you're actually exposed to plutonium, or you're actually exposed to radiation. Low dose, which is one of those types of situations that makes you get cancer. The difference between a low dose radiation and a therapeutic radiation is that therapeutic radiation kills a cancer cell. Low dose radiation, like radon, only makes the cell sick to the point of becoming mutated and becoming cancerous.
Make the screening a part of your own wellness program. Think of it as your yearly checkup or your mammogram, I would say, and suggest to those that might fit that criteria to have that lung screening done. November is Lung Cancer Awareness Month. So, Doctor, let's now get into prevention and treatment options. I mean, as far as prevention goes, not all lung cancers typically, I would assume, can be prevented, but there are a lot of things that you can do that would lower your risk. And that is, of course, stop smoking.
Well, yes, prevention, of course, is the avoidance of things that are going to cause you to go into a cancerous type of situation. However, as I've always depicted, a cancer risk is how close are you to the cliff. Now, if you have a family history of cancer, especially of lung cancer, you're closer to falling off the cliff than someone that doesn't. Anybody can get cancer, but if you know that that's going to be the case, you are asking for trouble by smoking. And smoking doesn't only give you the risk of cancer, but it can give you the risk for other diseases that will not help your case when it comes to treatment. If you have heart disease, if you have renal disease, if you have bladder disease, then we have the options can become limited based on your comorbidities or the other diseases that are caused by the cigarette that are going to cause you to be able to not receive, let's say, the state of the art. So you have, a big challenge by already starting with, let's say, significant emphysema. This it's not surprising that if you smoke, you're going to have emphysema, and the emphysema classifications can be, just a mild asthmatic type of emphysema to the type that is very severe, where you need to be wearing oxygen at all times, and even then your blood oxygen saturation is low. So imagine if you only have a very small reserve in your lung, and then you have a cancer, that you may be even a very early case, but any kind of treatment is just going to be one less normal cell that you have available for breathing, and of course that will be that. So here again, the availability of techniques and treatment options can be related to your general health.
Smelling oatmeal. That's something that you have mentioned to me before, that if you start all of a sudden just smelling oatmeal, and I looked at you, I will never forget this. I looked at you and I'm like, what in the world are you talking about? Would you explain a little bit further about that?
Actually, I give it, it can be oatmeal or anything else. People sometimes don't realize that some symptoms are trivial to the person that doesn't understand them and may not mention it to their primary care physician. And one of them, let's say, is smelling something that isn't there. In this case, let's just say it's oatmeal. Well, that can be a seizure. And the cancer, as I mentioned, of the lung primarily can go to bloodborne into the brain, the liver. And the seizures can be very subtle. It can be, as I said, smelling something that isn't there. That is a form of seizure. It can also be, if it's going to the brain, something where you actually have headache with nausea that you just cannot stop no matter what. And it's not indigestion. You see that every time, even at night, you have nausea and vomiting. It's something to report. But you may also have other, we haven't really talked about small cell carcinoma. Small cell carcinoma is a different type of cell. The cell in small cell carcinoma is very unusual because it can have all kinds of paraneoplastic syndromes. Paraneoplastic means around the neoplasm, around the cancer. And these symptoms can be very strange. Like, for instance, you have just muscle pain, generalized muscle pain, or generalized bone pain, or an excess thirst. You think you may be diabetic, but it may be cancer of the lung. So you see, sometimes you want to explain things in a very easy manner. I'm thirsty because I ate a lot of beef jerky and it's very salty. But when you begin to see that it's out of proportion, or for instance, you're tired, yes, you are working harder, but it's just completely out of proportion. You're falling asleep even before your dinner is served. You need to seek attention. And if for some reason you feel that people are not really coming to a conclusion that is satisfactory to you, you should not stop. You should continue searching because, again, sometimes even small cancers of, let's say, small cell cancers of the lung can give you odd symptoms. Flushes, for instance, you can be getting flushed. Your skin becomes red for no reason, or you have diarrhea for no reason. These can be cancers of the lung. Many people say, gosh, I get so tired with the treatment. And maybe there is something to the rigors of the treatment that make you tired, but the majority of people are tired because their body is actually working very hard to get rid of the dead cancer and also be building new tissue. So you can imagine it's trying to tell you, look, I'm working hard. I don't need to compete. You don't need to compete with this work. So it is very important for people to put every effort into eating and maintaining their weight. There's many articles which show that there's a direct relationship between survival and people that can maintain their weight. If you cannot maintain your weight and you're continuing to lose weight, what we call failure to thrive, your survival is measured in months. And no matter what we do, that's the end. And you can stop this. You can stop this by eating despite not being hungry, eating and keeping up your normal daily activities so that you can be back with your normal activities once the treatment is done. And here again, the psychiatric part of it is very important. If you become depressed, because of course, who wouldn't be depressed with any cancer diagnosis? I don't care even if it's a skin cancer. It's something that worries. And if you worry, you will depress your system and you will not fight. Your body will be so entertained in trying to lift your spirits that it will forget the most important element in fighting the cancer, which is in the local area.
It's just amazing. Sometimes, you think about how your body can produce these cancer cells, and at the same time, you're trying to beat them and keep your spirits up and keep your healthy, living up in order to be successful and to beat something that your own body produced. It's just crazy. It really is. I said that all right, didn't I?
You did. And the most important thing is, I think that out of anything that I like for people to remember here is, please see your primary care physician if you're at risk.
Yes, very much so. Thank you, Dr. Perez-Tamayo. We appreciate you taking the time to listen to Cancer Explained with Central Care Cancer Center. With facilities throughout rural Kansas and in Missouri, Central Care Cancer Center offers complete cancer care all under one roof, so there's no need to travel far for the best in care. Whether you need radiation or chemotherapy, access to clinical trials and novel treatments, financial counseling, or other supportive services for yourself or your family, Central Care Cancer Center is here for you. You have a choice. Bringing expert care to you is an important component in the success of your outcome. Even being surrounded by your family and friends, that can be the factor that elevates your treatment. Feel free to reach out by calling 800-592-5110 or visit us online at cccancer.com. And as always, you can send an email to askdoctor@cccancer.com. For Dr. Perez-Tamayo and all of our amazing providers and nurses, I'm Leanne Powers. Thank you for listening.
You've been listening to Cancer Explained with Central Care Cancer Center, offering expert cancer care that's close to home. Central Care Cancer Center has clinics throughout Kansas and in Missouri. Central Care Cancer Center, online, cccancer.com.